Hello everyone, welcome back to my channel and thank you so much for watching. Today I will show you the DIY method of removing a mole on my right hand. I have done this many times in the Philippines as a beautician worker and as a salon owner. This is a very common procedure for us, but first let me give you a brief background on moles and the ABCDE technique of identifying moles. This will let you know if you need more advice. A mole, in certain cases, is considered a mark of beauty. Some people go to the trouble of adding moles on specific parts of their body. For example, their faces, to enhance their looks, but in most cases, they become troublesome as they are unsightly moles that get larger as they age are like targets on your face, as people tend to zero in on them immediately and deflect from your overall appearance. Thus, we find ways, and there are several of them, to remove moles. In this instance, I will show a mole that I wish to remove, but it is not on my face, but on my hand. I will show the pros and cons of mole removal and what to look for in identifying problematic moles. When I say problematic, it refers to moles that require a qualified medical person to properly assess it and remove it. Otherwise, mole removal is just a technique. Not unlike tag removals, moles are just pigmented skin, while tags are unsightly growth that keeps growing bigger if ignored. The ABCDE technique of identifying moles: asymmetry, border, color, diameter, evolving. How is it done? Mole removal is a simple kind of surgery. Normally, your doctor will do it in their office, clinic, or a hospital outpatient center. They'll likely choose one of two ways. Surgical excision. Your doctor will numb the area. They'll use a scalpel or a sharp circular blade to cut out the mole and some healthy skin around it. They'll stitch the skin closed, surgical shape. This is done more often on smaller moles. After numbing the area, your doctor will use a small blade to shave off the mole and some tissue beneath it. Stitches aren't usually needed. Are there any risk? It will leave a scar. The biggest risk after surgery is that the site can get infected. Carefully follow instructions to care for the wound until it heals. This means keeping it clean, moist, and covered. I use the second method, or use a commercial off-the-shelf mole removal too. Here's the scalpels. And the blade that I was talking about earlier. So either scalpels or blade. And also there's another one that I am going to use today. Here's my mole removal pen. I have two with me here just in case ran out of battery. I have extra. Actually, guys, I had an experience 5 years ago. I had mole on my face, on my left side lips. So they used a blade to shave off my mole. So they numb it, and after a few minutes, they use blade. They shave off my mole. So I didn't feel anything and it's not painful, but when you see it, it's scary. But you know, they are very professional and they are doctors, so they know what they're doing. Sometimes the area will bleed a little when you are done, especially if you take meds that thin your blood. Start by gently holding pressure on the area with a clean cloth or gauze for 20 minutes. If that doesn't stop it, call your doctor. A common mole won't come back after it's removed completely. A mole with cancer cells might, the cell can spread if not treated right away. Keep watch on the area and let your doctor know if you notice a change. In this case, since I cannot use my right hand, I will use my mole removal pen. Come on, let's do it. We can do this. I will show you guys what we will need. Alcohol. This is my disinfectant alcohol, 70%. We will use alcohol first before we start. Here's my mole removal pen. And I have needles here, and instructions, and charger. So we have triple antibiotic ointment. After the procedure, we will need this antibiotic. And of course, we have to numb my skin. So using this numb 520, we will attach the small needle. This is already sanitized and I boiled it. I boiled and soaked it in the alcohol, and I put in my sterilizer machine. We need to clean the area. And here's my mole. I am going to start now. Let's use 5 intensity. I can smell, so we need electric fan here because I can smell the smoke. I'm going to use the electric fan. Kind of little dip. It's deep, but getting there. It's getting there. It's getting there. not bleeding. The black color is gone. See that? Okay. The black color is gone. There you go. A little bit more. I hit my healthy skin right there, but it's fine. As you can see, guys, there's no bleed. There is no blood coming out, but I got so deep now. But as you can see, the black color is gone. Oh my goodness. Successful, guys. And I am going to put some triple antibiotic ointment. I am going to cover I am done, and I did it. I did not feel any pain. I just got scared because I'm kind of a little nervous. You know, when you do it for someone, you are fine and you have confidence, and also you have nothing to worry about anything because I know what I'm doing. But if you do it for yourself, it's kind of a little scary and nervous because that's how I feel. But anyway, guys, I did it. I hope this DIY helps you by at least giving you some information about mole removal. But as a disclaimer, I must warn you that I have a lot of experience doing this, and I would not recommend you doing it on your own without supervision, especially to those who are weakened by the sight of blood or turned off by the smell of burning flesh. The procedure itself is not painful, so all is good, and I will wait until 5 days or less, maybe 4 days, 3 days, and let's see what's gonna happen, and I will update you guys. And now I conclude this video. This will be all for today, and I hope you like, share, subscribe, and hit the bell to be informed about my next vlog. Bye for now. Thank you so much. This is after 2 hours.